How to give yourself an injection. If you've ordered peptides or injectable hormones like testosterone, you will need to self-administer injections as outlined in your dosing protocol. Although this may seem scary at first, we promise that once you do 1 or 2 injections, you'll feel comfortable. At BLI, we recommend doing your injections subcutaneously, even testosterone. Subcutaneous injections are injected into the fatty tissue layer between your skin and muscle. You will often hear this referred to as SubQ or SQ when written in dosing instructions. Subcutaneous injections use short, thin needle tips. This is different than intramuscular or IM injections, which use longer needles injected much deeper into the muscle. Your prescription will arrive in either pre-mixed or lyophilized form. Pre-mixed peptides will come in liquid form. We refer to this as reconstituted. This means that the peptide ingredient has already been mixed into the solution. Pre-mixed peptides are ready to be drawn up and injected. Alternatively, lyophilized peptides will come as a dry powder that you will need to reconstitute yourself by adding bacteriostatic water to the vial. You should receive the water along with the peptides. If you received injectable testosterone, it will always be in liquid form. In this video, we will go over how to do each of these types of injections, including how to properly prepare, inject, and store your medication. First, before starting, let's understand how to interpret your injectable prescription dosing. You should have been sent syringes with your package. If you are missing syringes, please reach out to BLI and we will get some shipped out. For most peptides, you will use an insulin syringe. For these, the injection needle tip will already be connected. This needle will be between 27 to 31 gauge. Leave the cap on for now. For viscous medications like testosterone, you should have syringes and needle tips separately. We'll review this later in the video. Look at the syringe size. Typically, you will receive 1 cubic centimeter insulin syringes. 1 cubic centimeter or 1 cc is equal to 1 milliliter, which is equal to 100 international units. Don't get confused by all of these different measures. All you need to remember is that cubic centimeters are equivalent to milliliters and equal to times 100 IU. You may also have received 0.3 cc or 0.5 cc insulin syringes, depending on your dosing amount. This doesn't change your dosing at all. It only changes the amount of liquid that will fit inside the syringe. On the syringe, you will typically see lines marked off in measures of 10. This indicates 10 units and is equal to 0.1 milliliters. Now, review your dosing directions on the packaging. Let's use the following example. Your directions state to inject 50 units subcutaneously once per day. Now remember the conversions. 100 units is equal to 1 milliliter, which is equal to 1 cc. In this example, 50 units is equivalent to 0.5 milliliters. If you are using a 1 cc syringe, then you would draw up halfway to the 50 or 0.5 mark. Let's do one more example. Inject 0.25 milliliters subcutaneously twice daily. 0.25 milliliters is equal to 25 units. Draw up to the 25 line mark between 20 and 30. Inject this twice daily. Now that you know how to read your dosing instructions, let's go over how to administer the injection. In this video, we will be covering 3 types of subcutaneous injections: pre-mixed, lyophilized, and testosterone. First, we will discuss the injection for a pre-mixed peptide, and later go over how to prepare your lyophilized peptide injection. Always wash your hands before administering your injection. Then, gather your supplies. This includes your peptide vial. First, remove everything from the shipment packaging. This includes any peptides, reconstitution kits, and syringes. Many medications will be shipped with ice packs. Do not worry if the ice pack has melted. Reconstituted peptides maintain their viability without refrigeration for several days, and your medication was likely not off ice for very long. Lyophilized peptides and viscous medications like testosterone or PPS do not need refrigeration until they have been mixed. Before throwing away the shipping box or envelope, double-check you've removed everything out of it, as sometimes the vials may be separate from the supplies. Now, look at the smaller box or bag containing the medication vials. On it, you will see your dosing instructions. Next, grab an alcohol wipe. If you get your prescriptions from the pharmacy, they usually include alcohol prep pads. If they do not, you can purchase these at your local grocery or drugstore. Lastly, you'll need a syringe. Depending on the dosing prescribed, the pharmacy should send you the syringes you need or BLI can ship you some. We will start with how to inject a pre-mixed peptide. Remember, pre-mixed peptides will arrive in liquid form. If this is your first time opening your peptide vial, first pop off the plastic lid or pull the tab. The covering can be discarded. Wipe the rubber stopper with an alcohol wipe. Remove the protective plastic caps from the syringe's plunger and needle. You need to keep the needle sterile, so don't let it touch anything. Fill the syringe with a little air by pulling back on the plunger an inch or so. Push the needle through the center of the rubber stopper at the top of the vial. Keep the needle in the vial. Turn the vial and syringe upside down. Then, fill the syringe with the liquid peptide by pulling back on the plunger until the black tip is even with the line showing the number of your dose. Now pull back a little extra, so you can push any air back in the vial. Small air bubbles will not hurt you. Leave the needle in the vial while holding the vial upside down. If there are air bubbles inside the syringe, gently tap on the side of the syringe to inject the bubbles back into the vial. Next, push any extra liquid you pulled out back into the vial, so the top ring of the plunger is at the exact line mark of your prescribed dose. As a reminder, if you are injecting 0.5 mL, then align the edge of the stopper to the 50 mark. Turn the syringe and vial right side up. Remove the needle from the vial by pulling it straight out of the vial. Recap and set down to keep the needle sterile. Put the peptide vial back in the fridge. Now you're ready to give the injection to yourself. Next, choose a spot on your body for the injection. You can inject into your abdomen anywhere at least 2 inches away from your belly button. You can also inject into your love handle, upper glute, or outer thigh. Clean that area of your skin using the alcohol wipe and let it dry. The location is your preference. Be sure to switch locations regularly to avoid always irritating the same location. Now slightly pinch a fold of skin where you will give the injection. Hold the syringe at a 90-degree angle to your skin so it's standing straight out, right above the place where you'll give the injection. Insert the needle swiftly into the pinched-up skin, about a 1/4 inch or so, then press the plunger completely to release the medicine from the syringe. Take the needle out at the same angle you put it in, then let go of your skin. Gently rub the spot you injected for 30 to 60 seconds to help avoid welts or bruises. Dispose of the needle safely by using a needle clipper to clip the tip if available, or by recapping the syringe and putting it in a puncture-proof or sharps container. Now we will go over how to prepare your lyophilized peptides for injection. The process for injecting is the same as just described. The only difference is in the initial steps to prepare. You will recognize the peptide as a lyophilized peptide because you will see powder in the bottom of the vial. This prescription will include a reconstitution kit. The reconstitution kit includes bacteriostatic water, either a 5 cc or 10 cc syringe, and a bigger needle to put your bacteriostatic water into your vial. First, you will need to reconstitute the peptide. This means you will need to add bacteriostatic water into the vial to mix with the powdered peptide ingredient. Open your large 5 or 10 milliliters syringe. Pump the syringe a few times. This will make it easier to draw the liquid. Attach the large needle you received in the kit to the syringe. This needle will twist on directly. Keep the needle tip capped as you twist it on. Prepare the bacteriostatic water. If this is your first time using the bacteriostatic water, pop off the plastic lid or pull the tab. The covering can be discarded. Wipe the top with an alcohol prep pad. Uncap the reconstitution syringe. Stick straight down into the bacteriostatic water. Turn the vial upside down and pull the needle until it's in the actual water. Draw up the water into the syringe. For example, if your reconstitution directions are to reconstitute with 4 mL of bacteriostatic water, pull up to the 4 milliliters mark on the syringe. We recommend pulling more than you need into the syringe, then press the plunger of the needle to go to the proper amount to get rid of any air bubbles. Flip the vial right side up and remove the reconstitution needle and recap the needle. Keep in mind that you will generally have more bacteriostatic water than what is needed to reconstitute. You are allowed to use the same vial of bacteriostatic water to reconstitute multiple peptide vials. We suggest storing your bacteriostatic water in the fridge with your peptides, though refrigeration is not required. Now clean the top of the lyophilized peptide. Take the syringe with the bacteriostatic water, uncap the reconstitution needle and insert into the peptide vial. Depress the plunger of the syringe, releasing the bacteriostatic water into the lyophilized peptide. Dispose of your bacteriostatic needle safely in a puncture-proof container or sharps container. Once the bacteriostatic water is in the peptide vial, it is reconstituted and active. You can give the vial a gentle twist by rubbing the vial in between your hands slowly or gently turning it upside down 1 or 2 times. Do not shake the vial. If you notice powder is stuck to the sides, you can place the vial horizontally and gently swirl the liquid to blend the mixture. You are now ready to inject the peptide into the body. Follow the same directions previously outlined for how to administer a pre-mixed peptide injection. Lastly, we will discuss giving yourself a testosterone injection. Dependent on the provider's recommendation, testosterone can be administered as a topical cream or injectable fluid. Testosterone is a more viscous fluid which requires 2 needles, a draw needle and a smaller injection needle. The draw needle makes it easier to pull the medication into the syringe, and the small needle is used for injection. Also, because it is a more viscous fluid, refrigeration is not required and can actually make it harder to draw. To start, use an alcohol prep pad and wipe the top of the vial. Take the syringe and twist on the larger draw needle. This will be the 18 to 21 gauge needle. Place the testosterone vial on a sturdy surface. Remove the cap of the draw needle. Holding the vial steady on the table, insert the syringe with the draw needle through the rubber stopper straight down into the vial. Holding the syringe in one hand and the vial in the other, flip the vial upside down and draw out the required amount of testosterone. Flip the vial right side up and remove the syringe. Recap the draw needle and unscrew it from the syringe. Screw on the smaller injection needle. This needle will be between 23 to 27 gauge. Leave the cap on. Next, choose a spot for the injection. For testosterone, we recommend using the love handle, glute, or outer thigh. Clean that area of your skin using the alcohol wipe. Let it dry. The location is your preference. We recommend switching locations regularly as to avoid always irritating the same location. Now slightly pinch a fold of skin where you will give the injection. Hold the syringe at a 90-degree angle to your skin so it's standing straight out right above the place where you'll give the injection. Insert the needle swiftly into the pinched up skin, then press the plunger completely to release the medicine from the syringe. Take the needle out at the same angle you put it in, then let go of your skin. Gently rub the spot you injected for 30 to 60 seconds to help avoid welts or bruises. Recap the needle and twist it off from the syringe. Capped needles can be disposed of in a puncture-proof container, such as a glass jar or a sharps container. After completing your injection, make sure to properly dispose of your needles. Peptides should be kept in the fridge, especially if they are pre-mixed. Lyophilized peptides do not require refrigeration until they have been reconstituted. However, we recommend storing both lyophilized and pre-mixed peptides in the fridge to help preserve the quality longer. Testosterone should be kept at room temperature for ease of injection. Good work! You've done your injection. Don't worry if you notice a small bruise or elevated welt at the injection site. This is completely normal. If this happens, we recommend placing a warm compress on the spot and being sure to rub the injection site immediately after injecting for any future injections. If you notice a more severe response, please reach out to your healthcare provider. As always, our team is here to help you and answer any questions you may have. If you still have questions on your injection or would like additional training, please reach out to schedule an injection training by requesting an appointment through your portal or contacting our office. We look forward to working with you on your journey to optimized health.